Good day, this is Dr. Regina Reyes, and I will be your lecturer for this topic. That is the first part of neurocytology and the pathologic reactions of the cells of the nervous system. In relation to my second topic, that is demyelinating diseases, in particular multiple sclerosis. Good day. To begin with, let us review the cellular elements making up the nervous system. So of course you know the neurons as well as the glial cells or the supporting cells. The neurons are the functional and the basic units of the nervous system. They come from the ectoderm of the embryo, particularly the neuroectoderm. So the neuroectoderm, as you know, will give rise to the future peripheral and central nervous systems. Okay? And I'd like to remind you that mature neurons do not undergo proliferation anymore, and most disease processes affecting neurons produce only neuronal degeneration and loss. So we have to conserve as much as possible these functional mature neurons. The supporting cells of neuroectodermal origin are as follows: oligodendroglia, Schwann cells, the astrocytes, and the ependymal cells. Glia comes from the root from the Greek word which means glue. So mainly these cells really glue together or support the neurons to make up the nervous system. So first we have the oligodendroglia. These cells, form the myelin sheaths in the central nervous system. So they're in the spinal cord and the brain. The Schwann cells, on the other hand, form the myelin sheaths in the peripheral nervous system, the peripheral nerves and the cranial nerves. The next set of supporting or glial cells would be the astrocytes or the astroglia. They are widely distributed throughout the CNS. They are very important. They have a lot of functions. They usually lie near both the neurons and the blood vessels. So you would come to learn later on that these astrocytes have these functions. They support neuronal migration during development. So they assist these small neurons or developing neurons to go to their places, the proper places in the central nervous system, during development. They provide substrates for neuronal energy metabolism. They maintain homeostasis, and the chemical microenvironment for the neurons to work. They contribute to the regulation of synaptic transmission and the coupling of local blood flow to neuronal activity. And they participate in response to injury and repair of the nervous system. So they proliferate also when there is injury to the nervous system. Then we have the ependymal cells. Again, this is of neuroectodermal origin. They're the ones that line the ventricular system. So they form a single layer of ciliated columnar epithelial cells lining up the entire ventricular system. They provide a very effective selective barrier between the ventricular fluid and the brain substance. So the ventricular fluid cannot just enter the environment of the brain parenchyma. The ependyma gives rise to the choroid plexus, which are inside the ventricles and which produce the cerebrospinal fluid. And then lastly, but not the least, we have the microglia. So this one is quite different. It comes from the mesoderm instead of the ectoderm. It is actually a blood cell, a macrophage. Okay, so I usually tell my students microglia starts with the letter M, so it must come from the mesoderm, which also starts with the letter M. So they are of monocyte lineage that migrate into the central nervous system along the blood vessels from the mesoderm surrounding the neural tube. So they're actually blood cells, no, migrating into the CNS. They proliferate to become scavenger cells, or what we call specialized macrophages, removing damaged tissues. So they proliferate again in times of injury to the CNS. And normally, in relaxed or physiologic states, these cells are usually in small numbers. We also have connective tissue cells from the mesoderm supporting the nervous system. Okay, so obviously we have the meninges, no, the pia, the arachnoid, and the dura, supporting the brain and the spinal cord, as well as fibrous connective tissues surrounding the peripheral nerves. So these are the endoneurium, perineurium, and epineurium of the peripheral nerves. Okay, so how do we lose these cells in the nervous system? What are the mechanisms for cell death? So neurons, glial cells, and endothelial cells may follow at least two separate pathways for cell death. The first one is necrosis due to a pathologic condition, or apoptosis, which is already programmed in the cell. And these two differ morphologically and biochemically. Necrosis reflects an underlying pathologic process that produces any of the following. So first would be an abrupt and severe loss of supply of oxygen or glucose for ATP production. This is very common among patients who suffer from stroke and cardiopulmonary arrest, as well as in prolonged states of hypoglycemia. Remember that the cells of the nervous system are very dependent on a steady supply of blood that brings these substrates. Second would be excessive mechanical strain, that is trauma. And thirdly, through excessive increase in neuronal energy demands as seen in prolonged seizures. So it is very important for us to control seizures ASAP so as to lessen the loss of functional cells. Apoptosis, on the other hand, is programmed cell death. So this is actually a very essential process for normal development and tissue homeostasis. And important triggers for apoptosis include DNA mutations, inflammatory mediators, abnormal accumulation of intracellular proteins, and oxidative stress. So it's just like having a predetermined lifespan for each of the cells for each cell in the nervous system. Now let's look at the different pathologic reactions of the neurons to injury. Okay, so on the left of your screen is the diagrammatic representation of the neuron. Okay, so you have the neuron cell body and the dendrites coming out of the cell body. And then you have one long process that is the axon covered by some myelin. Okay, the myelin sheets are produced by the oligodendrocytes in the nervous system, in the central nervous system, while the myelin sheets in the peripheral nervous system are produced by the Schwann cells. On the right side, down there, right lower hand part of the slide, would be the microscopic picture of a neuron. Okay, so here you have the neuron cell, the body, and some of the dendrites. We're not sure if this long process here is actually the axon. So any disease leading to a patient's death is associated with changes in the body chemistry and physiology affecting the appearance of the neurons. And these are very non-specific. It doesn't tell you what the cause of the death is. So these changes in the appearance of the neurons may be due to the catabolic processes that proceed after death. We call that autolysis or autolysis, and the mechanical procedures can distort appearance of the neurons. The next one is neuronal cell loss, which is very non-specific also. Okay, so if we have now a patient or an individual who suffered from ischemic injury, as in deprivation of oxygen and cessation of oxidative metabolism, this leads to specific pathologic changes. Okay, so the common causes for ischemic cell change would be loss of blood flow, as in strokes or strangulation, lack of oxygen in the blood, status asthmaticus, lack of substrates necessary for oxidative metabolism, hypoglycemia, and poisoning blocking the oxidative metabolism, such as in cyanide poisoning. 8 to 12 hours after the injury, the neurons become smaller and angulated. No? Look at this picture on the right side. No? So instead of that stellate shaped neuron I previously showed you, the neurons become smaller and they shrink and become sharply angular. The cytoplasm becomes eosinophilic, namumula siya. The nucleus shrinks and becomes darkly stained, okay, unlike the picture I showed you. And if there is a complete dissolution of the neuron, you will end up with a red, dead neuron, which is already irreversible. Okay, so how about the biochemical and molecular events which we do not see after ischemia? So several minutes after significant ischemia, if we were not able to reverse it, 2 to 5 minutes, no, the respiratory chain process which produces our ATP on the inner mitochondrial membrane ceases. And so this depletes our ATP stores, and our ATP are very important in the ion channel functions in the cell membranes. So there would also be impairment of the ion channels, no, the sodium potassium pump, no, etc. And the brain will now resort to anaerobic glycolysis, which leads to production of lactate. And lactate itself further inhibits mitochondrial function. If we were not able to restore blood flow and oxygenation, this will lead to irreversible changes in the cells, no, that ultimately lead to cell death through excitotoxicity. Too much excitation leads to toxicity, accumulation of intracellular calcium, and generation of free radicals. Okay, so now we move on to the specific reactions of the neurons to other forms of injury. So the first one is central chromatolysis. This one happens in the neuronal cell bodies after severe injury to its axon. Okay, so say for example, its axon got severed, okay, the neuron cell bodies will also react in the form of swelling of the neuron cell body, dissolution of the Nissl granules, and the nucleus migrates to the periphery. This usually happens in 2 to 3 days after injury and reaches maximum at 2 to 3 weeks. This is usually demonstrated in large motor neurons, and it is also called axonal reaction. Unlike ischemic cell change, this can still be reversible, and the normal appearance of the neuron may be restored in a few months. How about the axon? If, say, for example, the parent body is destroyed, or if it got detached or severed from its proximal axon. So this is what we call Valerian degeneration. This occurs in the distal part of the axon when the parent body is destroyed or separated from the axon by disease or injury. In both the CNS and the PNS, an axon, of course, cannot survive when it is separated from its cell body. Unlike in the CNS, Wallerian degeneration occurs more rapidly in peripheral nerves, where degenerative changes are completed in a few weeks. In Wallerian degeneration, impairment of axonal transport happens because there is detachment from the parent body or proximal axon. The neurofibrils also disappear, and the axon breaks into small fragments that eventually disappear. In the PNS, or the peripheral nervous system, there is a chance for the nerve to regenerate, okay, if the parent cell body survives. But this regeneration of the axon does not occur in the CNS. Why? Because each axon and myelin sheath in the peripheral nerve is surrounded by a basement membrane, which is composed of the Schwann cell and by a delicate connective tissue sheath called the endoneurium of the nerve fiber. Both these structures maintain the integrity even as the axon and the myelin degenerate. Here is a diagram of the difference between an axon inside the CNS and the peripheral nervous system. So in the CNS, no, the axons are covered by the oligodendrocyte myelin sheaths. They do not have a basement membrane. But in the peripheral nervous system, these axons are covered by Schwann cells and endoneurium, which comprise the basement membranes that are still intact even as the neurons or the axons degenerate. In the central nervous system, there are no basement membranes or collagen sheaths or the endoneurium surrounding the nerves. The oligodendroglia are also incapable of proliferation, thus a new axonal growth has no path to follow. So functionally significant regeneration of tracts does not occur after damage to the CNS. In the okay, so again, to remind you of how our neurons look like. No, so we have stellate neurons with dendrites or short processes coming out of the neuron cell bodies. We have a central nucleus, okay, and an eccentric nucleoli. Okay, the axon is the longest process coming out of the neuron cell body, and it is covered by myelin sheath. Inside the CNS, this is covered by, or this is produced by oligodendrocytes. In the peripheral nervous system, this is produced by Schwann cells. Look at this drawing. This is how it is in the CNS. You have one oligodendrocyte in the middle, the circular one, that projects some myelin sheaths, no, to different segments of different axons, multiple axons. Okay, this is how it happens in the CNS. So if you destroy one oligodendrocyte in the CNS, a lot of axons are affected. Look at this drawing. This is Now we go to how the oligodendroglia react to injury. These cells are extremely sensitive to injury, including ischemia and metabolic disorders. They have a range of responses to injury that vary according to the type of the lesion. When affected by a pathologic process, their nuclei shrink or just break up and dissolve. On the right side of your screens are the cross-section of the pons of a patient who has multiple sclerosis. The one on the top is stained with myelin stain. So supposedly, the areas of the pons that has myelin should stain dark. And notice that there are light areas or light patches on the left side of the pons, that is on the right side of your screen, okay, that are not stained with myelin. So on glial fiber stain, the one on down there, no, sa ibaba, that is a glial fiber stain. It shows as gliosis or proliferation of the glia in the uh, previously light stained areas above. No? So this shows us that there is proliferation of the glial cells in these areas wherein you have demyelination. There are two types of diseases that can affect or destroy the oligodendroglia. The first one is demyelinating or myelinoclastic diseases, and the second one is the dysmyelinating, or what we also call them the leukodystrophies. Okay? The demyelinating or myelinoclastic diseases, here you have already normal myelin developed, okay, and this is somehow attacked by some exogenous agent which is usually unknown and broken down into its component lipids and absorbed. So an example of this would be multiple sclerosis. So you have normal myelin in the first place being destroyed by some agent. The second one is desmyelinating. So here, myelin in the first place is abnormally formed owing to its genetically determined error in metabolism. So we also call this leukodystrophies. So leuko refers to white matter or white, and dystrophies is to the abnormal maturation or development of the white matter. So this one is because of a genetically determined error of metabolism. So the myelin here is unstable and easily breaks down. Demyelination is very nonspecific. It can be caused by ischemic or an infectious or toxic or metabolic injury to the oligodendrocytes. But this is also most often immune-mediated. And the most common immune-related demyelinating disease is multiple sclerosis. These myelinating disorders, or the leukodystrophies, result from the failure to form and maintain normal myelin sheaths. They're genetically determined disorders that are commonly due to defects of lysosomal or peroxisomal metabolism.